Thanks, man. If you remove this or put a hyphen there, scientists, you guys are also involved, so don't worry about it. This will pass everything, but this talk is more for you guys than any other. Thank you, Pam, for Bill, for introducing me, and thank you for coming. Basically, you know, the research stuff that you mentioned is probably my earlier times. My tail end is more into the geo-environment and how it relates to human health, etc. So that's more what I'm trying to lean towards now, based on my experiences in developing nations and other areas. So, if you look at these two pictures, okay, if you characterize this as a system and also that's a system, this is the habitation or human habitat, and that's also human habitat. Okay, there are elements in this habitat, there are elements in this habitat. Okay, the difference in these two is the environment. Okay? The same element, the same humans. If you zoom it down further, the difference is the environment for these two systems. Now, you can see that humanity is equal. However, the environment, the living standards, the health are far opposite. And of course, if you look at it from a perspective, general perspective, I am, therefore I pollute. So whether you live here or there, you still contribute to the overall pollution. The difference is the level, the degree, or the spectrum of the pollution. And I think that poverty is one of the key contributing factors to this difference. And how poverty couples to the environment, degradation, etc., makes the whole difference. So if you look at poverty and environment, it is formed. They are coupled system, basically. Here, poverty forces people to put pressure on the environment, one or the other. And more so even in developing world or poor nations. Now, so in poor nations, and again from Ghana perspective, if you go to the villages, when they see that people are dying early, around 60s or 50s, they will say, okay, let me produce a lot of children now before I die. So you see, you know, the man marrying 3 women, 4 women, and before you realize they have about 25 children, okay? So they produce a lot of children, and that in some indirect way put some pressure on the environment, because basically they have to provide needs, farming, etc. Here, most of the work on the land lack environmental protection knowledge. So people who live in the poor environment, they have little knowledge or no knowledge at all about the environmental protection, no education whatsoever. And therefore that propagates or leads to more environmental degradation. Also, inadequate waste disposal. Here, when I just ate, I had a trash can, I put it in developing nations, we don't have anything like that. So you have to find its way somewhere. Limited access to sanitation leading to poor hygiene practices. So that's what poverty sort of couples or leads to the environment, what it contributes to the environment. The other way around, what does environment, as poverty, basically it causes more suffering from the poor. The poor environment or very bad environment causes more. So you look at overcrowded areas where definitely you have poor health. You look at environmental ecosystem damage, and therefore it increases the risk of flood and natural disasters. And in places where there are little land, and therefore people, you know, sort of cram for land to farm, etc., you have soil erosion and infertility because they do over, graze and over farm and everything, so it leads into less food. So you can see that poverty and environment are somehow coupled. Now, I chose this because if you go back to these two slides, these slides are here, you know, I probably don't belong to the elements here. Yeah, okay. So I don't know, I think there are a lot of rich folks here, so maybe they belong to here. I probably tend to gravitate closer to this side, so I chose this angle to talk about. Okay, so so basically, I using these two platforms to talk about two cases that I have worked on in Ghana. This I have done a lot of work and published a lot in here, but here it's just about to start. And basically, this is nitrate contamination in drinking water from farming activities. Basically, the poor locals, and most of the cases, they are little girls who drop out of school or they can't get education, and therefore they have little babies, children at early age, 17, 18. They have babies and they have no idea how to take care of these babies. They are the people who make primary work. The men do the farming, sell it to them, and they have to take it and then go out to the streets and the areas to work. So this has some poverty at the line base, one or the other. Here is another area in Ghana where basically it's a male-dominated environment where the auto mechanics basically have an area where they plaster and repair cars. Okay. Now, basically, it's also mostly high school dropouts who work there, or no school at all. The males, they have no education, nothing, and their way to survive in the future is probably go and learn auto mechanics, repair, and then move on. So these two areas have, some gender. Which here, the males, the females do work in these areas, and here too is a male-dominated environment. So this here platform, I just want to establish some cases where there could be potential cross-disciplinary research with societal impact, and this I think it's a challenge for geoscientists, engineers, and global health scientists. Bill, I'm just putting you in the spot now. Okay, so this is my main drive, in terms to establish any potential cross-disciplinary research. Now, so the first platform, so if you look at this here, this was some work I did earlier on, maybe 4 or 5 years ago. I took some group of students from Duke. We went to some village close to Suame, and I'll show that. This is the only source of drinking water for a cottage of about 8 houses, 10 houses, with about 11 children and some adults there. This is the only source of drinking water. So when we went and saw this student couldn't leave the place, and we were there when the little girl brought a pan and just wiped out this green stuff here, took some scoop and drank it and started, fetching water. So that is the source of drinking water. And the green stuff is the algae from the fertilizers where the farmers, do apply onto their farms. So just to give you a quick orientation, this is basically Ghana, from western part of Africa. We are surrounded by 3 French-speaking countries, Cote d'Ivoire, Burkina Faso, and Togo. We have population close to 24 million. The official currency is cedi. We have a variety of denominations, regions, the traditional religions, and then Muslim and Christianity. We had independence for the British in 1957. The GDP is around 16.45 as of 2013. Now here, the GDP dominantly is via agriculture. It takes about 33.6%. So you could see that this farming activity is everywhere. The application of fertilizers and other activities is everywhere throughout the country. And basically, the study area is in Suame is about 12 kilometers from the capital, Accra, here, and it's the district where basically it's a farming community. So overview, and again I'll talk about the nitrates from the fertilizers, as I indicated earlier. Basically, nitrates are essential. Most of you have medical here, and it's used in everyday life. But the difference is when there's high concentration, it can cause a lot of health problems for humans and the environment as well. So high concentrations can cause health hazards in humans, animals, ecosystem, and the economy. Economy in the sense that when the groundwater is polluted with nitrates, the cost of remediating is so expensive, very, very expensive, and it puts a toll on the economy. Like a country like Ghana, for instance, is very devastating. So it has significant. Now, the main issue here is the conversion from nitrate to nitrites in the digestive system, especially in infants. And this is the main concern because where we worked, a lot of infants from girls aged between 16 to 20 rampant, and they are very, very ignorant in most of in the cases where their mothers have to help them, but their mothers also get busy, so they have to do it themselves, and they don't do it, so it becomes a big of a problem. They do occur in foods and groundwater, and basically shallow wells and sandy aquifers are the most vulnerable, and this is what we see mostly from the area that we work. Now, so the typical source of nitrates, basically from leaching of crop fertilizers, this is the key. This is what we are looking at. There are other sources like from septic tanks, which is also a problem in the working world. I'll show you very quickly. There are, other sources like waste from livestock operations. In Rwanda, Botswana, there were some cases where about 500,000 of cattle died from huge pollution of nitrates in the waters that they were drinking. Just like that, they were having livestock abortions, etc. Of course, there are natural sources of nitrogen as well. So here, the crop fertilizers here, this is a septic tank, and very common in the working world, where unfortunately some of these tanks are very close to the houses that people live in. So and they use groundwater wells as well. So huge diversion of nitrates with that. Now the unfortunate victim is basically a small child like this. Now I show this picture to see the blue characterization. In Ghana, the kids, we are all black, so we don't see any color difference. But here, I'm showing that to see what it looks like. Fever, blue characterization, and therefore they tell me the blue baby syndrome, which is basically the convulsion cases that we see in Ghana. And I'll show you an example where in the area there are huge convulsion cases. Now, this is is option from the World Health Organization and then UNESCO. They really declared in 2006 that convulsion is the #1 killer of infants in Africa in general. So basically, the health impact is that babies under 6 months, they are their prime victims. And they suffer from nitrate toxicity because of the high intestinal pH, which enhances this conversion. And basically, when this gets into the stomach and it goes into the system, they tend to deplete the oxygen as well, and therefore, basically, most of the kids have depletion oxygen, and that leads into the convulsion symptoms that they have. We have gas for breath, high fevers, crying, colorization, which we don't see from the blood pool. So that is a very, very big problem. There's also a lot of birth defects and miscarriages, and that unfortunately was very rampant in the area. It's heavily rampant, and again, the unfortunate thing is that everything that happens, death, sickness, is sort of ascribed to which prophecy, juju, and other stuff. In fact, most of the villages, that is precisely what they will tell you. And I'll show you some examples very quickly. There's no, you don't have a sense that there's a medical problem, recognition. That is out. Basically, they have a quick reason why some of these things happen. Also, by World Health Organization, it causes colon and bladder cancer in adults. The World Health Organization limit for safe nitrate concentration in drinking water is 8 parts per million. In fact, in some countries like US, they've even made it stricter to 10. So this is a very, very hardcore limit that is set by World Health Organization. And anything above this 8 ppm is considered a health hazard for drinking purposes. There are also other problems for other people that are interested in, again, livestock and even fish. I mean, high level fish in aquatic systems where the rivers have been identified as having very high nitrates concentration, and the fishes just keep on dying. Now, I'll say this because it just came out that a lot of the manufacturers or the fertilizers in these developing nations, they import industrial waste from developing nations and as an additive to the fertilizers, and that really amplifies the problem. So you have industrial waste plus the nitrate concentration, the nitrate itself. So in addition to nitrate, there are other industrial wastes that add to the fertilizers. So if you buy a poor quality fertilizer, then the health problem becomes even worse. And that, unfortunately, is a problem. So I wanted to just let you know this, and that is illegal according to the Western Convention in 1992. Unfortunately, most of these factories are set by Westerners, employ locals in place. So just to let you know about that. Now, so the farming practice, the main source of income, basically in the locals in this area, is sale of pineapple. So if you look at this guy here, and this lady, a very young lady with a baby, that's the main employment or job activity. You go to carry this load here, go by the roadside like this and sell it. They're making probably $1, $1.50, $2 a day to take care of the infants and kids. So you see the guy is pointing. So basically, he wants to get those fruits that are big because that's what sells. So he points them to them, and then he just picks those fruits. Now, these guys, because of the fact that these women, when they come there and buy them big fruits, they tend to apply more fertilizers to the farms without even thinking that there's a limit to the application, because they want those fruits to get big, to sell and make money. So see, the poverty is one of the underlying reasons why these practices tend to occur in this area. And basically, you see the little girls, they just carry these to the roadside and sell them. So the males tend to, produce this, and then the carrying, the selling, everything is done by the females. So there's that gender parity there. Now, so the fertilizers are applied indiscriminately, again, as I said, to have higher use and therefore more income. Now, there are government regulations with regards to this. There are extension officers who probably have this knowledge in mind. They try to tell the farmers what they have and what they can do, but these are largely ignored by the farmers. I think, in essence, it's because of the fact that there hasn't been any good relationship between the extension officers and the farmers. They just come in and tell them, and over time, they haven't trusted them. When they set up a time to come, they don't come, and they drive in big SUVs, and these people are poor. So there's that disconnect between the poor locals and the extension officers. So largely, they really don't take what they say to them. So the locals here basically rely on groundwater for every domestic need drinking. There are very few streams around, so everything is from the boreholes or the wells. Now, so this is where the geology comes in, why they use a lot of the fertilizers. So the place we have the rock types called the Togosiri, they are basically quartzites, okay? So when they weather into this rocky, sandy type of material with very little nutrients. The bed, the soil is very, 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 very shallow in thickness. So we're talking about maybe maximum of about half a meter of the soil. The rest is all rock. But these rocks are fractured, so that's where the leachate. Okay. So with this here, basically, it's hard to have any nutrients or plant across, so they have to apply the fertilizers. And here, pineapples are nature the only crops that are grown there because they have very short fibrous roots, and you don't have to go deep into these rocks. So anything, as long as they have nutrients, it's fine. Okay, so that's the notion why they have pineapple farms around the area. And of course, the fact that this is not rich in nutrients, they have to apply the fertilizers to get that. So basically, if you apply the fertilizers, there's basically leachate. You have precipitation which enhances the leachate into the groundwater table, and basically there's a feedback system where they are taken up as drinking water from the pumps. or boreholes. So basically that is the idea. And again, as I said, about 90% of the towns or villages in the area rely on groundwater because there are very little streams around. So whatever they put in, it comes back to them through leachate and it's hard. So if you look at here, this is a crop yield versus the fertilizer applied, because that's the amount per area. So if you look at it here, if you apply the fertilizers, yes, you have a crop increase in crop yield, but there's some point here where is a optimal application. There's nothing to increase the crop yield. It's very insensitive to the application. So everything that you apply goes down as a leachate into the groundwater. So this is a concept that if we can frame it to the farmers to understand, that would be very great. In fact, the Duke Engage program that I did develop, I use this as a template for the students to educate the farmers from village to village. We covered over 50 villages. So I use this as a template, let them understand what it is, and we use that to tell the farmers what is really happening. So it's not necessary that you have to apply a lot of fertilizers, because the crops or the plants itself may exceed the plant demand and also the denaturalizing capacity, after which everything goes into the groundwater. There are other factors that affect that, but this again is the key, that you don't necessarily have to apply a lot of fertilizers to achieve the maximum nutrients. You can apply some limit based on analysis of the soil, etc., and still have a big fruits for you to sell. So that was our main environmental message or educational awareness that we took to the locals. That's why I did. So we did some sampling of the water. So basically, we go there around 5 p.m. when all the farmers are come from the farms and they are coming to take water to drink, to cook, etc. So that's the time that we take the samples to at least to see what they are taking in. So this was one of the programs where I had the students taking the water around the time. We had a hack spectrometer which we were able to do some site analysis of the water. We also took some streams, samples. Okay, so this another stream that is hosted by maybe 20 houses. That's all that they have, and we did also analyze the nitrate concentration. So quickly to show you some of the results. So this is the nitrate concentration in bars, and the red line is the limit for the nitrate concentration, 8 parts per million, as indicated by the World Health Organization. So if you can see, some of them go about 5 times the limit. In fact, this is just an example, but most of the villages that we tell the samples, about 80% were above the World Health limit. Okay, so that is the cause of concern. We did that over the season, July, November, March, and then June, cyclic, so we can factor in the dry and the rainy season as well. There were some fundamental differences, but not much. In most cases, they all exceed the limit. So basically, this is a summary where we have the nitrate concentration from 12 months, and we have a sample frequency of every 3 months. Most of the wells have levels that exceed the 8 grams per liter or the 8 parts per billion. And sometimes, but this Aburi well that we had a high school called Aburi, nice Aburi High School, I believe. It's a very popular, very traditionally well-known high school in Ghana, and most of the students go into that well and take the water for drinking. But that had very high nitrate concentration levels. Now, the problem is that the water is so clear like this, some of this water. Okay, so it's hard to convince them that it's very contaminated, but when you test it chemically, it's way up. And that was a dilemma for us to really convince the villagers that this water is not healthy, because they won't even listen to you, because the fact that they see it as clear and they don't have any worry, because there's no alternative, basically. So this was the association between the nitrate concentration and the convulsion cases. These cases were given to us by the medical center, the medical director. They have one medical center that covers most of the villages around. So after our initial touch, we were able to tell him to please document these convulsion cases. Now, initially when we talked to him, he felt that most of those cases that come were due to malaria, because he said that he never thought that nitrates could have that effect on him. So we started alerting him to really document these cases, and that's what he gave us. And we look at the nitrate average over the year, the 2-3 years that we have. So this is the, you can see very reasonable correlation between the nitrate concentration and the convulsion cases. And so this was something that he has taken over to the ministry, and I don't know what is following up now. I may get to know when I go back in June. But this, to me, is very alarming, and the fact that they are very young teenagers, if I can put it, between 17 and 20, having all these babies around. And the death rate, in fact, in closed door, he said, could be between 60 to maybe 65%. Because a lot of times they put a kids in a room and they go outside to do something. So sometimes before they come, the child is stiffened and dead, almost dead. And this is where the issue of tradition, they attributed to witchcraft and all those stuff together, without even thinking that there's some underlying problem. Okay? So again, these are girls around 17, 21, they have no education, nothing. They just have children, unfortunately, and the victims are these innocent infants. Yeah, so this is what, is there any questions here? So this was the education awareness campaign that we took. This lady here had just had her baby died just about a few days before we went in there. The same cases. So you could see the agony in her face, and that was very, very, very sad, because he said he went to the hospital, and the usual thing was that a fever and therefore malaria. That was what she had in mind. But there were several cases. So we had a little bit of education awareness where we talked to some of the chiefs, and they would call the locals, and we had to try to convince them. We realized that was it was working well, because a lot of people saw me as a local, and therefore if I speak, I have an accent, I'm a local, and they hardly want to listen to me. So this girl was in my class, and I took her, and then the whole dynamic changed. They were able to listen to her attentively and carefully, because she's probably from other environment, and they said that if this lady had come all the way from the US, it means he has something good for us. So we might as well listen to her. So that's what prompted me to do a Duke Engage program, where I took a bunch of students to Ghana, and I sat down as just a pastor, and they had to talk to the villagers through an interpreter. And believe me, it did work well. So here are some examples where we go to the villages, we talk to them, and basically they all come and gather and listen to the educational message that we have for them. We also use the school children, because in that environment, when most of the mothers are not educated, so if the child goes there and say, Mama, I heard this is the new thing, we have to hear, the moms tend to listen to the kids more. So we use them as a channel to educate their mothers. So basically, after the education, we did some sampling, 2008, 2001. Well, we see decreases in the nitrate concentrations around the area. I don't know whether it's due to our education or that, but we did it at the same time, the same season, and the same week that we took the samples to make a comparison, and we could see the changes here. Now, we talked to most of the chiefs, and then he said that most of them have changed their practices. Most of them have changed their practices just by the education that we gave them. So there's something there that can work, and therefore it takes the engineers, the scientists, the public health people, and other people to really come up with this idea. So global health scientists, geoscientists, engineers, we all have a stake in trying to address this crisis. I think it's a crisis. Because this issue, even though it's in that district, it's everywhere in Ghana, across the farming communities, and even further in Africa. It happens. So one solution to a template may well serve the rest. Now, very quickly, so I'll move on to the other platform. Well, I just put some few solutions. So prevention is probably better than cure, so we have to make sure the quality of fertilizers is good, and also provide some incentives to the farmers to really heed up to this. There must be some environmental health and education awareness, as we did, and that I think will slowly take to solve the problems. Also, we need some map, soil map and permeability mapping, so that we can actually demarcate areas of high leachate, which will cause the nitrate contamination. And most of these boreholes were set up by NGOs, and there were no environmental impact assessment at all. So everything is just dumped there, and then it just leaves that. We also have to see whether we can do frequent water quality monitoring, and also maybe as engineers try to design affordable and less sophisticated purification systems, which are sustainable. All right. So I'll go to the next one, which is basically environmental pollution from automotive oil waste, basically from an area which is slated for automotive mechanics, what we call the mechanic village. Basically, people who work there are high school dropouts or people with no school at all, no education, and yeah.
Before you go to that, can I ask a question about malaria in that other site? What did the malaria rates look like in each one of those communities? This one. How did it compare to the nitrate levels that you had?
Well, honestly, we didn't look at the malaria at all. That's way out. But that's a potential area that we can look at. But you see, we don't have a lot of streams in the area. One, most of the water comes from the boreholes, basically. And the farming activities, we don't have big trees that will have this precision and that stuff. So I didn't really consider the malaria. But of course, the medical officers thought that malaria was key to the convulsion, but that's something to really look at.
In general, these areas have much lower malaria incidence compared to the rest of the country. And the reason for that is that, number one, it's high altitude.
Yes.
So the mosquitoes don't get high. Now, the second thing is that a lot of the water in these areas are all running water. So because they're on a high altitude, all the streams run fast. So mosquito breeding is
very
yes, minimal.
Now the other aspect would be the environmental, where they will put maybe a bowl, a basin somewhere, but people don't have that luxury to be putting basins around. So everything's kept to the houses. So
the unfortunate thing with Ghana is that any illness that presents is malaria.
Yes.
And so they treat it for 6 months or 3 months or whatever, for a period of time when it doesn't go away, then you start thinking about other things.
Yes, precisely. Someone had
Yeah. What accounts for the variation in these different communities? There are three of them that have much lower incidences of nitrate in the soil.
Yeah, so it could be the landscape, where they grow the pineapples and the slopes and the amount of land that is used for farming. Because some of these towns are bigger than the others, but some they still have that. So in some of the boreholes, it's just for, again, no impact assessment. It's just for convenience, a bit further away from the chief's house, a bit further away from the road. Those are the factors that dictate those the siting. It's not something geological or geotechnical or scientific in terms of the impact assessment. Yeah.
How are the infants getting the nitrates? Is it transmitted through mother's breast milk or?
No, it's from the water. So the little water that they can drink.
Okay.
Yeah, and everything is taken right from the bowls and then put it up. Now, if you look at the streams, if you look at here, see there are two streams that we did here. They are very low nitrate levels because of one, as Dr. Murphy said, there's flow. So we don't have, there's a mixing process, and the plants along the streams take some of the nitrates for their metabolism, so we tend to have lower nitrates around there. But within the boreholes, because the flow is very slow, anytime there's a plume coming in, the flow process is very slow, so they are localized, and therefore you can take it right away. And that's a problem.
So
Yeah.
can I just follow up on that?
Sure.
It's because you know the picture, the one woman whose child died, right? She died as the baby died very, very young. So I'm assuming that the you know, just it sounded like a few days
Yeah.
old or something. So I'm assuming the child would have been breastfed at that point. And so is it like?
Yeah, I'm sure that, and again, it's probably medical. There could be some residual nitrates in the breast milk and the system. I'm not very sure, but I know that for sure that the water that, because I've been there seeing mothers, you know, very young infant, around 4 months, but taking them water, giving them water right there. So,
Well, that, like a public health message that, you know, infants need nothing other than breast milk for 6 months, for the first 6 months, no water.
Yeah.
I mean, that could help to stem the convulsions as
Precisely.
well, so.
yes, precisely.
that's
So
a
these are
public
all,
health message.
I think, medical education, so many factors that, because I can see that if you can let them know that this method can maybe prevent you from having children. A lot of women will jump onto it and heed to that. Or in terms of the men, if this is going to mess up your manhood or your fertility, they all jump to it. There are certain myths that are very, very, that echoes. Others don't. If you tell them to go get cancer, they won't care. They don't even know about cancer. But if socially you can connect to their workmen, then it makes a bit.
Yeah, I think from an interventional standpoint, that's a very important, very simple step to curb a big problem. So breastfeeding. Yeah.
Please. One more question, Fred.
Yes.
There's a guy named Bryce Weinberg over at medical school who's found that nitrous oxide is a potential therapy for treating severe malaria. He found this in Tanzania children.
Nitrous oxide, okay.
Yeah, and I don't know, like I'm not a chemist, so I don't know how you go from NO2 or NO3 to nitrous oxide. But I don't know if that's something to
No,
look
it's
at.
nitrite, not nitrous
No,
oxide.
I know, but I didn't know if there was a way to look at kids who were highly exposed to nitrates
Mhm.
to see if that actually has a protective effect against malaria, even if they're getting sick from something else, because they're getting
Yeah,
nitrates.
that's true,
But
yeah.
I didn't know
Exactly,
if
yeah. That could be a
something
potential
to explore there.
lead, yeah. Potential lead. Okay, so jumping to this here, the automotive waste management, very, very poor than in Ghana and other African countries for that matter. And it poses a very serious environmental and health problems. Over the years, for the past probably 15 years, there will be huge imports of used cars, automotives, into the African nations. Probably when the Western world want to get rid of probably some of the used cars, you know, there's a sink somewhere there. So there's a huge import, and it's tripled over the years in terms of how many used cars are imported. So if you look at this year, there's a harbor, for instance, every week, huge import of used cars. Some are totaled, abandoned, accidents, they are imported back into Ghana, in other countries. And because of the population growth, it also absorbs them, okay, because it's high increased population. So these used cars are very, very useful. So they can get one car, and that is a big use in the village. So if you look at this car here, okay, this has been there for years, and it is always useful. See how people are enjoying in the car? Everything they do. But the problem is that these cars contribute hugely to the pollution process, because one oil change, because of the fact that when the oil is circulating, it sort of, there's a wear and tear in the engine parts, and this brings these heavy metals into a used oil. So the older the car is, the more problematic it is in terms of the potential contribution to pollution. But these are the old cars that we have in Ghana too. I'm sure this car has been there for years, and still this will still be useful. So the folks in the automotive village, basically, and I'll show you examples here. One, they are very uneducated, mostly high school dropouts. So if you go in the first time as an apprentice, you do all the contact work. You use your mouth to suck petrol from the carburetors, you know. Sometimes you swallow a little bit in you and you don't really care because you are supposed to do that. The disposal of the oil, you do it so many buttons. So if you start from that level and then go up till you become a senior and somebody comes for you and then the person comes to start. So I'll show you an example how this cumulative process contributes to the overall health degradation of the workers in the area. So basically it's the frictional wear and tear that, you know, extract these metals from the engine into the car. So most of the used oil have the pH and also the heavy metals. And these are metallic elements which have high density and they are toxic or poisonous even at very low concentrations. I mean, I'm sure a lot of people know it, but those of you who don't know, that's the feature of the heavy metals here. And even for people who are on the roadside, you know, it's been determined that the heavy emissions, emit some heavy metals, and that concentration of heavy metals decreases as you go away from the roadside. So if you are selling stuff on the roadside, you still have exposure to these heavy metals. Okay. Just quickly give you orientation. If you have oil, motor oil from a local gas station, these are the concentration of the pH, which are very, very toxic, by the way. These are the concentrations, and once they get into the car, used, and you change it, this is how they get elevated. Okay, so this, you can see the increase here, 1,000 folds, 10,000 folds, in terms of these pH, which are very, 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 very dangerous. So they change, the pH content increases by several amount, and they constitute to health threats in humans and other biological forms. Now, work done by Graham indicate that if you use some of the used oil on the skin over time, it develops local tumor. So you can see interaction of this used oil even with the humans developing these tumors. Sometimes they could be visible, sometimes they will not. Now, if you look at the heavy metals itself, again, this is the unused one, and that's the used. You could see the increase, a lot of big increases in them. And again, these are very, 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 very dangerous to human health, as I said, and other forms of biological life, because these metals can bioaccumulate and move along the food chain. And in most cases, as I'll show you, they use these water in watering vegetables which are sold to people. But the important point here is that, as World Health Organization people indicated, one use oil from one oil chain can contaminate 1 million gallons of fresh water. So this is, I think, a very serious issue. So what are the health effects of these metals? So you have lead, zinc, copper, chromium, nickel, cadmium. So one, damage to brain functions and DNA. They have negative reproductive and birth defects, miscarriage in women, very serious bone fracture as you age, or the adults, infertility, as I indicated, damage to the central nervous system, psychological disorders, kidney and liver damage, lung, skin, urinary tract cancer. Also, I think what I thought that was very, very interesting and disturbing is the diminished learning abilities of children from these heavy metals. And also the behavioral distortion of children, such as aggression. I never thought of this. This was some recent publications that I saw. So these are other environmental and agricultural impacts. Again, bioaccumulation, etc. I'll go to that later. So now, in this particular location, why I think it's so important is the fact that this mechanic village was, I think, created in the 60s strictly for automotive workers. It was following the British, approach of life, because we have these in all the British countries, former British colonies, Pakistan, India. They all have such automotive villages. But for this particular case, the Suame magazine is located at the head of a reservoir or watershed, which feeds into a reservoir that supplies about 40 to 50% of the water supply in the Kumasi metro area. Okay, and that, I think, to me, is a disturbing fact. So I just quickly, in the area, we have these soils that have these properties that are said that there can be easy infiltration of these heavy metals into the water system. Okay, these are the properties. These are average properties, but these are indicators of the fact that it could leach very, very easily. Okay, so that's what I mean. So these indicate that there's high potential that these heavy metals, if they are in the system, will really leach into any flowing or any river system. So this is the activities of the auto workers in the folder. So you can see this oil disposal. They just dump them onto the air floor. These are some of the sources, and these you can see hundreds and hundreds of these spots all over the place. So everywhere they are dumping the used oil. So given what I indicated and the content of this heavy oil, you can see the health implications, the fallout health implications. So these collectively join the flowing system. Okay, what they do, some go by runoffs. I'll show you a picture of that. So these collectively go to a system and they all flow to join the watershed which feeds into the reservoir. So you can see the potential problem in terms of health and environmental effects. Okay. So, and also around the area, so this is the Suame magazine area, and this is the Owabe reservoir. There are a lot of rivers that feed into this reservoir, and most of these rivers are also unfortunately compromised with a lot of pollution, with human waste and other toxic materials. They all come and then they all join into a cycle form. So, in fact, ever since I saw it, I've never drank water in Kumasi area. So these are some of the stuff that I mentioned, and the farmers also who grow vegetables along these banks, of course, they use the water to water their vegetables. Same dirty water is used. Unfortunately, it's sold to people, which is very, I think, it's not a very good thing. Okay, and they use the same water for drinking, washing, etc. So this is basically a quick conceptual. So you have these villages here. They dump all this used oil. There's some runoff which gets into here and infiltrates to join the water table, and then people pump it up. Very shallow wells all over the place. Some undergo base flow and join streams, rivers, and in fact, most of the ecological and human health are compromised as a result. Okay, so that's the conceptual. This is a shallow well at the magazine area, very, very shallow. So this is drinking water for them. This woman fetches this water and they use that to cook around there, so all these mechanics and the friends will come and buy it. Okay, but sometimes, as you know, some of these heavy metals can even persist for a while in the system. But that is the source of water, drinking, cooking, etc. And if you have enough money, you can use some of the water to wash your car. Those who have money, we can just give them money, they come. So this has multi-purpose, doing a lot of stuff. But if you look at this one here and her little children, they all drink this water right from the source. So this is the potential problem that I'm talking. And here they use the same water in watering vegetable farms around the area. So basically, it's a quick thing to see. So this is the activities of the mechanics here and here. There's a slope going here. So every activity and the leaching comes right through here and join this water system, and the Owabe reservoir is somewhere here. So everything flows into that. And there hasn't been any study to actually look at what are the contents of this what is the environmental effects in terms of ecology, everything. There's nothing whatsoever. And that, I think, to me is very disturbing. So The Owabe Reservoir, as it was established, I think in the late 30s, 40s, was a sanctuary where they had exotic animals, exotic plant, a species, and people hardly even go there. Now, all the species are extinct. You don't see these beautiful birds and creatures over there. It's all because of the environmental pollution. The birds don't have the right because most of these go into the food chain and they affect all these berries and other stuff that plants eat. So we have extinction of these plants, of these birds around, and we don't have that canopy forest nice as it used to be. Everything has gone. And also the same is the fact that a lot of people fish in this. Okay, so you could see the bioaccumulation, whether these heavy metals have got into these fishes and they're eating them, nobody knows. Nobody has done any studies to look at them. But it's, again, this little girl here, that's what he does as the job. Okay? So again, back to we have the mechanic village here, the reservoir, everything flows into that reservoir. So we did some soil samples, so very few soil samples that we took along the drainage path in the area, and we took it to one of the soil science areas, and they did the heavy metal analysis to these standard procedures. And basically, this is what we found. So if you look at the lead levels, concentration, and these we have about 7 sites. And this is the threshold level for the lead by the World Health Organization. You can see all these places or sites are heavily enriched with the heavy metals. Very, very serious problem. They're all heavily enriched with these heavy metals. And lead, so many health effects, as you know, kidney functions, liver functions, and so many tests are combined with it. We also had the cadmium, and these are the levels. So basically, we had, I think, up to 40 centimeters. So we take the soil, go 40 centimeters down, and look at it, because that's the level that we have most of the enrichment. So that's cadmium, basically liver functions, kidney functions, renal functions are all affected by high levels of cadmium. Copper is what we had. The nickel had lower levels compared to the lower levels. We had the chromium also levels are fairly low, and we have the manganese, which have also high levels. So this was a study done in Pakistan where they look at the SGPT levels of auto mechanic workers, just like those in Ghana. And you realize that on the average, this is the control for people who don't work in the area or have no relation with the oil waste. And these are the people who work into the area. You can see that there are a certain amount of people who have high elevated levels in that basis. So these levels also affect liver functions and kidney functions, etc. We have other controls with uric acid, and again, the elevated levels tend to affect kidney and other organs. So this asks us to look at the average age of those automechanic workers. So they come at the age of 17 and work their way through. And when they come, they get exposed to all these levels. So if you take a control of their cohort, so in Ghana mostly you grow up with people around your area, so you know where people are. So this guy went into work for the auto mechanic, and this guy became a farmer. So two different people with no exposure, and those are people that you see that the average age at death of these auto mechanic workers is about 50 or 54, 53. So they come and start and I saw that several times. In fact, I was talking to some friends of mine where I live. There were 3 auto mechanic shops right into our house, and all the men were not producing children. The 3 of them, and this was something I saw myself. And of course, obviously, unfortunately, anytime that thing happens, they always attribute it to the women, that they are not, they are ones that are not actually producing baby. But in fact, this indicates the exposure to lead and these heavy metals can really decrease the quality of your semen and therefore brings out infertility. So this is a social problem which has a medical anatomical connotation, but because of the social setting, it doesn't allow us to look at these problems. So this was something that we got out, and we haven't even given that to the government or local officials. But this is what we see, and this will actually facilitate further working. What are these functions? The liver functions, the lungs, the kidneys, etc. Nobody has ever thought of looking at these, and these, I think, need to be looked at one way or the other. So I've looked at several issues. Even to what extent are the lands stream bordering this mechanic village? To what extent are they contaminated? Because we have a lot of people building houses around them, and everybody's trying to sink a borehole around this place. Everybody, because there's no water. Water is not flowing. Sometimes 2 weeks doesn't flow. So borehole is the alternative, but that is also the concern here, and therefore it has to be looked at. And I was thinking that the phyto remediation, there were some plants that were still existing under all this environment. So why are these plants surviving? I think there may be something within the botanical system that really don't really filter through the heavy metals, and therefore they can maybe take them up. We need to look at it from that angle. What are the health studies on the locals in the community? Nobody knows as of now, except for the fact that I just look at the age of death. That's all. But I think there's more to it. Can we develop a system where we can do recycling and treatment of this used oil so that we don't dump them to the system, become more and more useful? I think engineers may come up with something to really have some treatment or recycling so that it can be more useful. Just like we, sequester carbon and CO2 and other stuff. Maybe we can also do something similar where we can look at geological areas that can retain this or use oil without leaching to the greater areas. And the other scientific thoughts that I have. So basically, this is what I do have, and this I've left out a lot of the technical details, but I wanted to have a conversation so that we can look at it in a collaborative sense and come up with ideas how we can help solve problems in some of these poor environments or poor nations. So in the beginning, the graph I showed still stands. Environmental system, poverty, they are very coupled. Okay, so with that, thanks, and if you have any questions, we're going to take some questions.